Ministry of Health announces changes to hospital services and resumption of outpatient clinics. We'll have details to this story and more in the national report. Details to the news for Tuesday, October 12th, 2021. I am Chrisanne Mitchell. The Ministry of Health has announced some changes to the general operations and delivery of hospital services, one of which is the resumption of outpatient clinics. Acting Director of Hospital Services, Dr. Taisha Donald, said some of the changes are currently in effect, while others will commence on Monday, October 18th. The ministry was forced to make adjustments to the daily operations at the General Hospital, Princess Alice, and other health facilities following the spike in COVID-19 cases from mid-August to protect lives and prevent further spread of the disease. During Tuesday's post-cabinet briefing, Dr. Donald said the changes are being made in view of the significant decrease in the positivity rate of COVID-19 cases.
From the 11th of October, which was yesterday, we commenced the nephrology clinic, which is the clinic for persons with kidney disease, the oncology clinic, the clinic for persons with cancers, and the physiotherapy department will be starting from next week. From the 18th of October, we start all the other outpatient clinics which are in the outpatient area of the General Hospital. Internal medicine, obstetrics and gynecology, surgical department clinics, including general surgery, orthopedics, neurosurgery, ear, nose, and throat, and maxillofacial surgery. So all of these clinics will resume on the 18th of October. From the 1st of November, we will continue to roll out to the Princess Alice Hospital, where we conduct outpatient clinics also. So all the clinics that are generally held at the Princess Alice Hospital will be rolled out from the 1st of November. Princess Royal Hospital, we're also working toward rolling out the clinic from the 1st of November.
Appointments will be given and the medical records department will contact patients, informing them of the time they need to attend clinic. They are required to arrive at least 15 minutes before their scheduled appointment. Those with a fever or any COVID-like symptoms are advised to contact the medical records department to reschedule their appointment. While emergency surgeries continued, elective surgeries were placed on hold. These will now be scheduled from November 1st. Dr. Donald says there will be some changes with the resumption.
All persons coming into General Hospital for surgery will have to have a PCR test done 48 to 72 hours prior to the surgery. And on the morning of the surgery, you'd be expected to do an antigen test. So we just want persons to be reminded of that protocol and to take note. Persons for surgery all do what we call a pre-op check, which includes blood tests, sometimes X-ray, ultrasounds, ECGs. So because of the COVID-19 pandemic, one of the added things to the pre-op check was that of a PCR test. So yes, the PCR test has a cost. It's $135. Persons will do it 48 to 72 hours prior. And this PCR testing is to assist in caring for and protecting both patients and staff within the operating theater setting, which is a very high-risk area. So we need to know their status prior to surgery because added precautions would be taken once they're known to be positive. The antigen testing, which is done just before the surgery, it's free of cost. So this is at no charge to the patient.
A COVID-19 patient liaison group was established to improve communication between patients at the isolation unit, their families, and medical personnel in the unit, and this will continue. With 66% or 2/3 of the population still unvaccinated, Grenada remains at risk for another surge in COVID-19 cases. That warning from head of the COVID-19 medical response team, Dr. Dolan Noel. Dr. Noel, who is also the head of internal medicine at the General Hospital, warned that people should not develop a false sense of security because of the drop in COVID-19 cases. When Grenada transitioned to community spread in mid-August, the country recorded hundreds of positive cases on some days, but the number has started to significantly dwindle, with the latest data from the Ministry of Health showing there were 27 new confirmed cases on Monday. Dr. Noel says they are now monitoring several cases of post-COVID-19 syndrome, which means that long-term effects occur within weeks or months after recovery from the viral infection. Ongoing studies have shown that the symptoms can be new or persistent ones experienced during the virus. Dr. Noel says just as many people suffer from long-term effects of Zika or chikungunya, so too are others from COVID-19.
There are already people who have a sequelae of COVID-19, those who have recovered. And what happens? Usually the course of the illness is about 7 to 14 days. Most patients who come through our institution recover and are discharged within 7 to 14 days. However, there are some people who develop what you call a post-COVID syndrome. There are many terms for it. Some literature refer to it as chronic COVID-19. Some studies refer to it as post-acute sequelae of COVID-19. But the long and short of it is after you have recovered, there are some people who develop new symptoms or have a persistence of the ongoing symptoms, and we refer to that as post-COVID syndrome or post-acute sequelae of COVID-19.
Dr. Noel explained that individuals suffering from post-COVID syndrome can experience anxiety, fatigue, and shortness of breath.
Usually, those symptoms develop after 4 weeks or so, and they may persist for months. We are seeing people who have what you call a chronic fatigue syndrome. They feel tired all the time, and this is a sequelae of the COVID-19. There are some people who may have dyspnea, a persistence of the shortness of breath. There are some people who may have a persistence of the cough. There are some people who may take weeks before they regain the sense of smell. So all of that are some of the physical symptoms that people may experience after they have initially recovered from COVID-19. Joint pain, your body ache, your dizziness, and all of that. But there are some people who have a persistence of neurological symptoms. For example, we have patients who develop depression. And it's not difficult to understand somebody having gone through moderate or severe COVID and becoming depressed after. It's really, really a serious illness. There are some people who develop what we call post-traumatic stress disorder.
This is the National Report. The news will continue after the break.
Government, private sector, civil society, academia, farmers, the Ministry of Agriculture, Lands and Forestry, in collaboration with the Food and Agriculture Organization, invites you to World Food Day 2021, the virtual edition, under the theme, Our Actions Are Our Future, Better Production, Better Nutrition, a Better Environment, and a Better Life. Join us October 15 from 9:30 a.m. via Zoom, Facebook, GIS, and Real FM, as we recognize and celebrate the many successes of the agriculture sector.
Welcome back. The Ministry of Health is encouraged by the weekly decline in the COVID-19 positivity rate. From the period September 21st to September 27th, Grenada recorded 113 positive cases, 55 deaths, and 74 hospitalizations. Within the last week, October 5th to 11th, 31 cases were recorded, with 18 deaths and 23 hospitalizations. However, Acting Permanent Secretary in the Ministry of Health, with responsibility for hospital services and community health services, Hannah Julian St. Paul, said she is not satisfied with the current vaccination rate and commended those who have taken the initiative to get vaccinated. To date, 27,513 persons are fully vaccinated and 8,784 are partially vaccinated, giving Grenada a 29.34% vaccination rate. She warned against getting comfortable in the face of reduced positive cases.
This is a bit troubling for us at the Ministry of Health. It leaves us to ask the question, are we getting comfortable with the decline in the positivity rate? The number of new infections has been dropping consistently in the last 3 weeks. However, one death is one too many. We wish to take the opportunity to appeal to all. Let us not lower our guard because the reduced level of positivity and restrictions. Let us all remember that while the numbers are down, the virus is still in our midst.
Data from the Ministry of Health's COVID-19 dashboard shows there are currently 321 active cases. Director of Hospital Services, Dr. Taisha Donald, spoke on the current hospitalized cases at the various hospitals.
Presently, we have a total of 321 active cases, and of them, 33 cases are admitted, 28 at the General Hospital and 5 at the Princess Alice Hospital, with no admissions at the Princess Royal Hospital. So based on this, we're noting that there's a significant decrease in the number of cases that we have in hospital in comparison to weeks before. And for that, we're very happy. However, we cannot lose our guard. We still have to continue to follow the guidelines, follow our protocols, and ensure that we do mandatory wearing of face mask and wearing it properly, to continue to hand sanitize and to continue to avoid large crowds.
Continuing the news, government has announced the resumption of its farm labor support and debushing program. Infrastructure Development Minister Honorable Norland Cox, who on Tuesday shared an update on both programs during the government's post-cabinet media brief, said the programs are being resumed with strict observance to COVID-19 protocols. Government stopped the farm labor and debushing programs due to the recent spike in COVID-19 cases and the potential threat to lives. However, as of Monday, October 11th, gangs started work throughout the island on the nation's roads under the debushing program. Minister Cox said by Wednesday all teams will be deployed. He said COVID-19 protocols must be observed to prevent the further spread of the virus.
The program, as we know, we're just coming back because of the recent spike that we had. And as such, we have to be more vigilant as the workers go out there. So we have discussed extensively over the past 2 weeks before we commence to ensure that we prepare the workers to go back out there to do their tasks. As such, we have advocating and also putting in place the fullest adherence to the protocols that are established in our regulations regarding mask mandate, the distancing, physical distancing, and of course sanitizing where necessary or possible. The parliamentary representatives, they have also gone further in terms of their commitment towards this fight against COVID, and they have given a commitment to engage the workers through this program on the job. So within the next fortnight or so, in passing by, you may see parliamentary reps engaging with the workers. They too We'll be engaging them, talking to them. For some of the persons who might be still on the fence in terms of vaccination and being COVID smart in this particular time.
Minister Cox also announced that support to farmers under the Farm Labor Program will resume to push the government's agenda to increase agricultural productivity. He cleared the air on recent talks that said participants must be vaccinated to be given a contract. He said although government continues to underscore the importance of vaccination in the fight against the virus, beneficiaries are not obligated to be vaccinated.
There is no mandatory request for persons to vaccinate to participate in this program, but we are strongly advocating and also ensuring that persons adhere to the current protocols as regards to the wearing of masks, physical distancing, and sanitizing while they conduct the work during this program. We are asking you to just, when you come out to do your work, to ensure that you wear your mask, observe the protocols, keep the physical distancing, and to sanitize your hands as much as possible, wash your hands. So that is what we are asking. We are continuing to advocate through moral suasion, vaccination for persons in this group of workers as well who have not yet made the decision to get vaccinated.
That story brought us to the end of the National Report for Tuesday, October 12th, 2021. On behalf of the entire news and production team here at the Government Information Service, I am Chris Ann Mitchell saying thank you for joining us. Until next time.